Hey everybody, this is Joshua Tucker, the tendonitis expert. And this video is about what actually causes knee pain symptoms. If you have knee pain symptoms and you've been to a doctor, physical therapist, etc., you've probably been told that your knee pain symptoms are from the activity you're doing, like the running, or the walking, or the jumping, or the standing, or even the shoes you wear. That's the common answer to why you have knee pain. You might get a diagnosis like tendonitis or something, but that doesn't explain why you have the pain. And the why is usually, because of the activity you're doing, or your job, or you're on your feet a lot, or your sport, etc. But good news is the jumping doesn't cause knee pain, the running doesn't, the walking doesn't, the standing doesn't, and the shoes don't either. So, what actually causes knee pain symptoms? Let's briefly just go over the symptoms. If you have knee pain, you know what the symptoms are. It can be a shooting pain, or a dull pain, or a sharp pain, or a constant pain, or a comes and go pain. All those types of symptoms are available. Generally, when we talk about knee pain, we're talking tendonitis. You can have other injury, but if you have a ruptured ACL, you're probably not looking for knee pain, you're looking for ACL recovery, etc. So tendonitis is the general cause of the knee pain, but that's not really the cause, that's just a label for what you have going on and includes all the possible symptoms. As far as the where, you can have symptoms anywhere around the knee. You can have a specific spot, you can have a couple specific spots, but essentially if you have knee pain and knee tendonitis, then you're going to have pain right around there. You might have some tight muscles and some shooting pain up or down the leg, but essentially you have a spot or a couple spots of pain on the knee. That's the basics. You already know that. The real question you want to know is why? Why do you have knee pain? Why do you have knee tendonitis? And that is easily answered. Again, the usual response from doctors and PTs is from the activity you're doing. Or they're going to say that there's an imbalance in your knee. And that can be true, that you have a muscle imbalance, so the muscles are pulling in a non-balanced way, and that's pulling your knee off, and that can certainly be true. But the general, ultimate, real cause of knee pain and knee tendonitis is not due to the knee. Doctors, if you have pain right here, they're going to say you have a knee problem. Good physical therapists are going to say it's from other things like muscle imbalance, but for the most part, doctors are going to say that if you have knee pain right there, you have a knee problem. That doesn't actually answer the question of why do you have a knee problem. So, doctors are going to say this right here is the problem because it hurts, but really that's just a symptom. And we all know that symptoms aren't causes, symptoms are symptoms. Causes create symptoms. So what is the cause of your knee pain? Essentially, it's this area here. So these are big muscles. They attach to the foot. When you take a step and hit the ground, force transfers up. Now these muscles are supposed to absorb the force. So muscles are supposed to absorb force. But when a muscle is too tight, then it can't contract as much, it can't perform its job as much, so it doesn't really absorb the force. And where does that force go? It goes straight from the ground, past the muscle that are supposed to be absorbing it, and to the spot on the knee that hurts. Same kind of thing with Achilles tendonitis. If you have Achilles pain, the Achilles tendon is not the problem, it's just a symptom. Force is transferring to that spot because the muscles aren't doing their job of absorbing that force. And you might ask, well, why are the muscles tight? Why aren't they doing what they're supposed to be doing? And that is the tendonitis dynamic itself. Tendonitis dynamic. That's why whether I'm talking about Achilles tendonitis or plantar fasciitis or knee tendonitis, I talk about the tendonitis dynamic because the dynamic is made up of multiple factors all working together. And the tendonitis dynamic consists of 3 primary factors: muscle and connective tissue tightness, inflammation, and nutritional insufficiency, meaning not enough nutrition for your body to do what it needs to do. Along those lines, if you have knee pain in here, you don't have a problem right there. What you have is a dynamic. Essentially, we can say from here all the way to here, where you have too much tightness, you have some inflammation process, which mostly you feel right at the knee, and you have nutritional insufficiency, which means these muscles, which are supposed to be absorbing force and doing a lot of work, they can't work like they're supposed to because they don't have the nutrients they need to do so. And that leads to them, again, being tight and not absorbing force, and that force transfers up the leg to where you hurt. So if you have knee tendonitis and or knee pain in general, then you've probably been told to rest. But rest doesn't work because rest doesn't get rid of tightness, rest doesn't get rid of inflammation, and rest doesn't get rid of nutritional insufficiency. So rest is out. Corticosteroid injections are usually common, and they might help with the inflammation, but they don't get rid of the inflammation triggers. So inflammation is just going to come back sooner or later. And they certainly don't get rid of the tightness, and they certainly don't get rid of nutritional insufficiency. So corticosteroid injections is out. Splints and braces, they're kind of a band-aid. They can kind of help a little bit, but in no way, shape, or form are they a fix. So because they don't get rid of the tightness, they don't get rid of the inflammation, and they don't get rid of the nutritional insufficiency. So splints and braces might be fine to get you through the day, but they're not a long-term plan. Physical therapy can be good depending on your physical therapist, but they're going to do some stretching and they're going to do some strengthening, and neither of those, in my opinion, work for a variety of reasons, including when you stretch, everything that's mobile moves and everything that's not mobile doesn't. And what you need to target is what's not mobile, and stretching just doesn't do that. And strengthening implies that you're weak. But there's a difference between weakness and lack of function. So if you were just weak, you could go lift some weights and you'd get strong. Ta-da, problem solved. But in a knee pain scenario, a knee tendonitis scenario, it's not that you're weak, it's that you're lacking function. And if your muscles aren't functional, then making them lift weights isn't going to make them more functional. So I'm not a big fan of that. So for the most part, unless you get a good PT, that's out. So what you need to do if you want to get rid of your knee tendonitis, your knee pain, is you have to use an effective treatment that's effective at getting rid of the tightness in your lower leg, as well as potentially your upper leg. You have to get rid of the inflammation and the triggers of inflammation so that they're not releasing pain-enhancing chemical, which makes things hurt more, which tells your brain that there's a problem, which then has your brain tighten up muscles. And you have to correct the nutritional insufficiency, which means you have to take enough of the right nutrition so that your muscles can function like they're supposed to. If you'd like to find out more about knee pain, then check out my website, tendonitisexpert.com, and find the appropriate page.